Thanks for watching The 9.
All right, so school is out. Summer's here. Now, unfortunately, that does come with an uptick in injuries. Trampolines, rollerblades, scooters. They keep doctors at Michigan orthopedic surgeons very busy this time of the year. Dr. Christopher Minnock is a pediatric orthopedic surgeon. Doctor, good morning. Thanks for joining us.
Good morning. Thanks for having me, Alan.
Hey, Doc, so how much busier does it get for you guys in the summer?
You know, the studies say it's around 40% more in terms of injury rates for kids and teenagers in the summer, but to me it feels like it's a lot more. But it may just be what I do.
Sure, right, yeah. And now when it comes to everything, right, the head, shoulders, knees, and toes, what are some of the most common injuries that you see?
The most common injuries are typically to the lower extremity at the knee down to the ankle from a running, twisting, jumping type injury, or to the upper extremity, either the wrist or the elbow, typically from a fall where the hand is placed outwards.
Okay. Now, some kids, this question is funny for me, Doc, because it says many kids are too young to communicate how much pain they're in. What are signs parents should look for? So that's part A. But part B here, sir, is that my kids are the opposite. Everything is an injury. A stubbed toe is like a broken, I never know when to take their screams seriously. So both sides of that, how should we approach when our children, are in pain?
Yeah, it's difficult for kids that are younger to communicate exactly what they're feeling or where they're feeling it. You know, things to look out for that would indicate more of a serious injury or a fracture or swelling, especially with some bruising. If the child really refuses to put weight on the leg and you give it a little bit of time, they still won't put weight on it, that could indicate a bigger injury. You know, I think it's something if it's swollen and painful, but they'll move it okay or they'll walk on it with a limp, that's something I would watch and see how it does over the next couple hours or 24 hours.
We have a bounce house, a miniature bounce house. And of course, the first time we had it, Doc, at the time, I think she was 1. 2, maybe, she hurt her elbow, and we didn't know if you never know. So we gave her a cookie in her other hand and said, reach for the cookie. She couldn't reach for it. So there you go. We brought him in, and you guys fixed her up. Now, you specialize in pediatrics. What are the advantages of going to a pediatric physician?
One of the main differences between adults and children is the presence of growth plates in the bones. And this is an area of cartilage that's a little weaker than the bones and the ligaments around it. And a lot of times injuries or fractures go into or through this growth plate. A pediatric orthopedic surgeon has specialized training to treat these injuries to ensure it heals in the correct alignment and then goes on to grow normally afterwards.
Okay, so yeah, something broken on an adult may be totally different for a child as they've got a lot of growing to do, whereas we're in our bodies. Right. Doctor, you see kids, people, at their worst physically. They have these issues. How does that play in the rest of your life? Do you have kids?
Yeah, I have 3 kids, actually, 3 young kids.
I got to imagine that you're always on heightened alert. But also as a parent, you don't want to stop them from doing things. So how do you, take both of those sides into account?
You know, I think it's important for kids to run, play, go to the playground, do sports. And with that, you can have injuries from falls and just, even run around the backyard, you can injure yourself. I think the important thing is to be active, be healthy, and that may even prevent injuries depending on your sort of fitness level and how stable you are jumping and landing. So, my approach is to keep kids active and doing the things that they love, being physical. And if you do get injured, then, we'll get you on the healing pathway and back to whatever you like to do.
Wonderful. Sometimes that healing pathway can come in the form of a really annoying cast in the summertime. Yes. There are waterproof casts nowadays, though?
Yes, that's one thing that we're able to offer in the summer months for most fractures is a waterproof cast. That makes it a little bit easier to be in a cast during these nice summer months. And that's something you can get fully wet in a pool or in a lake and will dry out. It's a little different than the traditional cotton padded casts.
Is that typical, or is that like a specialty with you at your particular location?
It's an advantage to coming to see a pediatric orthopedic surgeon. Not all orthopedic surgeons offer waterproof casting, but that's something we certainly do a lot of at Michigan orthopedic surgeons in the summer. Okay.
All right. Well, there we have it. Some tips and tricks of the trade. Dr. Christopher Minnock, thank you very much. We appreciate you.
Yeah. Thank you for having me, Alan.
All right. More information can be found at miorthosurgeons.com. Have a good day. Lee Thomas, over to you.